Hello and welcome. Today we're diving into a rare and fascinating congenital heart condition known as Scimitar syndrome. Join us as we explore the intricacies of this anomaly, from its origins to its management. Scimitar syndrome, at its core, is a birth defect. The exact cause remains elusive, but it's believed to be a result of abnormal development during fetal growth. Specifically, it arises from errors in the formation of the pulmonary venous system and the right lung. It's not usually linked to specific genetic mutations, making it difficult to pinpoint the precise triggers of this condition. The hallmark of Scimitar syndrome is an anomalous pulmonary vein, usually from the right lung, draining into the inferior vena cava or other systemic veins instead of the left atrium. This means that oxygen-rich blood from part or all of the right lung is being diverted back to the right side of the heart, mixing with oxygen-poor blood. This leads to a reduced oxygen saturation in the arterial blood and an increased workload on the right side of the heart. Often, the right lung itself is underdeveloped, a condition known as pulmonary hypoplasia. Other associated abnormalities, such as dextrocardia, atrial septal defect, and pulmonary artery hypoplasia, can further complicate the circulatory system, intensifying the effects of the anomalous venous drainage. Scimitar syndrome is incredibly rare, affecting an estimated 1 to 3 in every 100,000 live births. Due to its rarity and variable presentation, accurate epidemiological data can be challenging to obtain. It's important to remember that while rare, awareness is crucial for timely diagnosis and appropriate management. The signs and symptoms of Scimitar syndrome vary greatly depending on the severity of the condition and the presence of associated abnormalities. Infants and young children may exhibit symptoms such as shortness of breath, rapid breathing, and cyanosis, a bluish discoloration of the skin and mucous membranes indicating low blood oxygen levels. Recurrent respiratory infections are also common. In less severe cases, symptoms may be subtle or even absent until later in life, with individuals potentially experiencing exercise intolerance or unexplained fatigue. Some might only be diagnosed incidentally during imaging for other conditions. Diagnosis typically involves a combination of imaging techniques. A chest X-ray may reveal the characteristic scimitar appearance of the anomalous pulmonary vein, resembling a Turkish sword curving downward towards the diaphragm. Echocardiography is essential for visualizing the heart's structure and function, assessing blood flow patterns, and detecting any associated heart defects. Cardiac MRI or CT angiography provides detailed anatomical information, precisely mapping the course of the anomalous vein and evaluating the size and structure of the lungs and pulmonary arteries. Cardiac catheterization may be used in some cases to measure pressures in the heart and lungs and to further define the anatomy. While Scimitar syndrome doesn't have distinct types in the traditional sense, it's useful to classify cases based on the severity of symptoms and the presence of associated anomalies. Some individuals have minimal symptoms and well-developed lungs, while others face significant respiratory distress and complex heart defects. The extent of pulmonary venous drainage, the size of the right lung, and the presence of other cardiac defects all contribute to the overall classification and guide treatment strategies. Treatment and management depend on the severity of the condition and the patient's overall health. In mild cases with minimal symptoms, conservative management with close monitoring may be sufficient. However, significant shunting of blood or pulmonary hypertension typically requires intervention. Surgical correction involves redirecting the anomalous pulmonary vein to the left atrium, restoring normal blood flow. Other procedures, such as pulmonary artery banding or repair of associated heart defects, may also be necessary. In cases of severe pulmonary hypoplasia, lung transplantation might be considered as a last resort. Medical management focuses on treating symptoms such as heart failure and recurrent respiratory infections. Unfortunately, there isn't a known way to directly prevent Scimitar syndrome since the exact causes are not fully understood. As a congenital condition, it arises during fetal development. Ensuring a healthy pregnancy through good prenatal care, avoiding exposure to harmful substances, and managing any pre-existing medical conditions can generally support healthy fetal development. However, these measures do not specifically prevent Scimitar syndrome. The prognosis for individuals with Scimitar syndrome varies widely. With early diagnosis and appropriate management, many patients can live relatively normal lives. However, long-term complications such as pulmonary hypertension, heart failure, and recurrent respiratory infections can occur. Regular follow-up with a cardiologist and pulmonologist is crucial for monitoring the condition and addressing any emerging issues. Recent research focuses on improving surgical techniques and developing less invasive approaches to correct the anomalous pulmonary venous drainage. Additionally, there is ongoing investigation into the genetic factors that may contribute to congenital heart defects, including Scimitar syndrome. potentially paving the way for future prevention strategies.